Welcome to today's Spotlight in Nursing podcast. I'm your host, Jennifer Scherzay, Senior Marketing Manager at Jones & Bartlett Learning. And today I have the pleasure of speaking to Dr. Dan Weberg. In addition to having clinical experience as a registered nurse, he's also one of our esteemed leadership authors, and he's currently the head of clinical innovation at Trusted Health. In addition, in his spare time, he also hosts his own podcast called The Handoff, which you can find on iTunes, Spotify, as well as on trustedhealth.com. Welcome, Dan. It's great to talk to you today. You've had a really interesting career. I was wondering if you could tell our listeners a little bit about how you got your start in nursing and a little bit about your role at Trusted Health.
Yeah, I started in nursing kind of by accident. I was in college and I was a business major, and I was sitting in my economics class, and I said, I don't ever want to sit in a cubicle again or for the future, and I started looking through all the majors and thinking about like what I liked in high school, and I really liked anatomy and the sciences classes. So I thought, hey, well, I guess the way to go then is pre-med. So I started the pre-med courses, and once I got into that, they kept saying, well, you need a backup. Not everyone gets into medical school, blah, blah, blah. And I said, well, nursing sounds good. I don't know anything about it, but I'm going to jump in and that'll be my backup plan. And as I continued through classes, just really started resonating more as I learned more about nursing, and dropped the pre-med stuff and jumped wholeheartedly into nursing. And loved it ever since. Best career move I ever made. And then from there, just so many doors opened up. I was an ER and trauma nurse for about 10 years at different level 1 trauma centers in California and Arizona. Got to work with some amazing leaders at Arizona State and Ohio State, Bern Melnick and Tim Porter O'Grady and Kathy Malik, which are all authors with JMB too. And that kind of catalyzed me into different roles that I never thought nurses did, which was, around technology. And so for the past 7 years, I was at Kaiser Permanente leading innovation work for nursing, doing everything from playing with Google Glass to AI to big data sets and wearable technology, to helping them build a medical school and writing curriculum on how interprofessional teams should work together. And then decided I wanted to jump and try something kind of risky and new, and joined a startup called Trusted Health, which is a technology platform for nurses to manage their career. And so you can think of it as like a LinkedIn meets Match.com for your job. And we take your profile and allow you to manage your whole professional life, from licenses to certifications to job history, all that kind of stuff that LinkedIn doesn't really give you as a nurse, and built it for clinicians, and then help you match your professional goals to jobs out in the world. And we want to be the premier career platform for clinicians in the world. And so it's been fun to build that out. And along the way, I get to host a podcast called The Handoff and do speaking events and continue to write books about, what I want to see change in healthcare.
Wow, that's pretty comprehensive. You're quite busy. And I love the fact that you started out in nursing and that opened a lot of doors to you. For some of the nursing students out there who have chosen that career, but they aspire to a leadership position someday, what advice do you have for them about how can they get there? How can they grow their career?
Yeah, I think the biggest thing, or like the biggest misconception I hear from people, is they feel they have to follow some traditional path, and that path is usually, be a good clinician at the bedside or in your care setting, and then become a charge nurse, become a manager, become a director, and then eventually become a chief nurse. And people think that's kind of the only way to go through the leadership ranks. And I think in my career, I've never done those roles. I was never a charge nurse. I was never a manager. I was never a service line director. I got to lead in different ways. So I went the nursing education leader route, and so I was both in academia and then on the health plan side or the health system side, leading education initiatives and influencing things there on the technology side. So I would say find your passion. What are you really interested in? Is it really the operational aspects of healthcare? Is it the education side? Is it the research side? Is it Is it the technology, innovation kind of disruptive side? And there's a place for you to lead in all of that. And it's more important for you to figure out where you're passionate about. And there's always a leadership position in that, rather than trying to follow some hierarchical kind of run-of-the-mill step pattern that may not be best for you.
I think that's great advice because I feel like many students across many different careers, whether you're, already evolved into your professional careers, might feel like you're right, that there is a specific path laid out. But I think following your passion and finding out what really interests you will really open some doors. You talk a lot about leadership. You're someone who has written several books for us on leadership. What are some ways that even entry level nurses or nurses who are just starting out in their career, when we talk about leadership, I know that that's quite a broad topic from what you and some of your peers have wrote about. Can you give us some examples about how nurses and even folks aspiring into those positions can demonstrate leadership so that they can get to that next level?
Yeah, I mean, at the simplest level, leadership is influencing others. And so nurses do that every single day. They do it with their patients, they do it with the patient families, they do it with their loved ones. And so, our concept in our book of leadership is not necessarily a formal position or title. It's how you can influence the people around you, your network, your professional network, your social network. And so if you think of leadership like that, you're doing it every day. And so you can hone your skills in the interactions you have minute by minute with people. So how can you influence that patient to take that first step when they need to walk early, or accept learn about the diagnosis, or whatever it is? You can practice that influencing skill right there. And then over time you get better and better at that. And then when you want to influence a big change, or you want to take a more formal leadership position, you've built up those skill sets. So I would say, if you're aspiring to jump into leadership, there's a couple things. One, just hone it every day, influence people every day, and try new things. There's skills out there, crucial conversation, that kind of stuff you can practice just on the daily basis with your peers. And then the other piece is to get really involved with your organization, wherever that is. If there's shared governance councils, if there's project teams, if there's unit councils, if all of those things allow you to step into a role of influencing towards an outcome, and all of that will build up your resume towards leadership. And I think what I found is the most beneficial is say yes. And see what happens. You don't always have to have the right skill or the right, resume or whatever, the right background. But if there's an opportunity that sounds interesting, say yes to it and figure it out. And usually it leads to something that helps you grow, or to the next step in your career.
Mm-hmm. Great advice, Dan, for sure. You have an interesting perspective where you've worked at Kaiser Permanente, now Trusted Health, and you started your profession in clinical practice, and you're also a nurse educator. So I imagine all of that gives you a really unique perspective. And when you look at today's healthcare leaders, what's one of the most important things you've learned that you'd like to impart to seasoned leaders who are already in the role, as well as new leaders coming in up through the ranks? What's the most important thing that you think healthcare leaders need to know or should be doing?
I think lately the number one thing that I've been talking about and trying to bring light to is this idea of, and this will sound negative, but toxic leadership. And I think it's something that just doesn't get talked about a lot. There's a lot of conversation around burnout and that kind of stuff, but the link between the leader and burnout is really strong in the evidence. And so if you're a leader that doesn't have the best leadership practices, or you're kind of chaotic in the way you interact with people, or you're not honing your practice of leadership, you have a real intentional or even unintentional consequence of burning people out, making them really frustrated, and actually destroying team cohesion. And so one of the things that I think is really important is that we hold ourselves accountable to practicing leadership like we practice nursing. And one of the examples that I give is, if you're a nurse and you make a medication error, that's a big deal. And people and the whole system will rally around trying to figure out that medication error. Like, why did that happen? That's unacceptable. We need to fix the system. But when there's a bad leader and they make people cry or yell at people, or the team's really frustrated and just can't get out of the funk, we go to that leader and we say, oh, well, that's just the way they are. That's their personality. You just got to get to know them. They're just a little rough around the edges, and we kind of excuse it away. But you never do that to a nurse who's making multiple medication errors every day. And so I think we need to hold ourselves accountable to understanding that leadership has as big of an impact on not only teamwork and burnout, but also there's links to patient mortality, and bad leadership actually leads to more patients dying. And so I think we need to think about leadership as being another quality indicator, another really important thing that we need to hold each other accountable for, instead of this right or title or something like that. It really does take practice, and there's a lot of evidence to learn in order to be an effective leader. So I think it's just the gravity of that position, and not to take that lightly.
I think you make a good point about the importance of strong leadership also in companies, whether they be healthcare companies or hospitals, really investing in their people, investing in that leadership training, because you're right, that does definitely set the tone, set the mood for team dynamic, and ultimately the happiness and the productivity, and that has that impact on patient outcomes. So it definitely all comes full circle. So thank you for that. I know in your textbook, you also talk a lot about the importance of interdisciplinary collaboration. What have you seen working in clinical practice that might be improved upon from a collaboration standpoint? And why is that so important for nurses to collaborate?
Yeah, this is something that I worked on recently with the Kaiser Permanente School of Medicine. So I was initially I was the only nurse on the team in a sea of physicians and other educators. And it was really fun to be a part of that. I learned a lot about medical education. And I was kind of assigned to help build out the interprofessional learning curriculum. And when the team looked at what was out there, the baseline of interprofessional education was really putting people in clinical scenarios and letting them kind of figure each other out. And there are some frameworks like team steps and some other things that are out there that are really good. But most of the interprofessional education in school is really around, like, can you run a code together? Like, and who's the leader, and what are you supposed to do when the leader says this? And we didn't see a whole lot of stuff around the basics of like how people interact with each other. So I think something that could be improved upon is really addressing the issues that make teamwork better, and some of the things that also break down teamwork. And so at the School of Medicine, we built out a framework that followed the IPEC competencies, or the interprofessional education competencies, and we wanted to address the hard stuff first. So the first class, where the nurses, the pharmacists, and the physicians get together, they talk about the assumptions they have about the other professions. And we even talked about doing skits around that, like, have the med students act out what they think nursing students are, and have the pharmacy students act out what med students, their assumptions about med students, and then use that to address those assumptions, and that just gets those underlying biases right away. And then we were then the next phase was talking about teamwork. So what is it like to work in a team? What's leading versus not leading? When should people step up, and how do you actually make that decision? And just challenging some of those assumptions, because right now, there's a lot of unintentional or informal hierarchy within systems. The physician is seen as the leader, the nurse is seen as the subordinate, pharmacy is kind of over here on the side. We don't really know what they do. And so I think just being more intentional about the roles and the scope of practice of each one of those professions and how they impact patient care, we could do a much better job of diving deep into that, and then helping all of those professions understand what makes good teams work. What's a high performing team look like, and dive deep into that before we get into throwing them into a clinical situation.
That sounds like a really interesting initiative that you undertook at Kaiser. And I think all companies could really take a lesson from that, whether it's a clinical environment or not, because every team, I'm sure, has a different kind of perception of maybe what collaboration looks like, or what someone in another department is doing. So kudos to you for leading that effort, for sure. So, switching gears a little bit to talk a little bit about the pandemic and leadership, given that nurses and healthcare workers, they're on the front lines during this pandemic and serving and taking care of patients. What do you think leaders can do to really support their teams and their staff during these unprecedented times?
Yeah, I think there's a couple things, and what's interesting, we did a study at Trusted Health right early in the pandemic, kind of when New York was at the peak of their COVID chaos, and we pulled about 1,500 nurses, and we found that nurses are more dedicated to the profession than ever. About 87% said they're more dedicated to the profession, and then we asked them how they felt supported by their health systems or their leaders, and they rated that very, very low. Only about 30% of the nurses said they felt supported in their mental health and wellness during the pandemic and just in general. And so I think, leaders, we're really good at the operations. We're really good at getting, staff, to the facilities. We're supporting them clinically, but I think we're missing the boat on mental health and wellness of our clinicians, and we're seeing that come out in, Instagram videos of nurses crying coming off shifts. We're seeing that in burnout. We're seeing that in suicide. And so I think, as leaders, we need to focus more on how do we support these professionals who are seeing crazy things every single day, and give them resources that help them manage that stress day to day. And the takeaway that we found as well was that there's employee assistance programs, and there's some other kind of apps and things out there, but what nurses really were asking for was a peer support network. And so one of the things we did at Trusted Health was we partnered with Ohio State University College of Nursing, Dr. Byrne Melnick and her team, to mobilize mental health nurse practitioners to be a support network for nurses that were going to the front lines of COVID. And that was received really well. And we also built out a coaching program where nurses got basically 8 weeks of health coaching facilitated by nurse practitioner students and nurse practitioner faculty. So peer-to-peer, kind of understanding what that nurse is going through on both sides. And that's got really great reviews, and our nurses are loving it. And so I think more programs like that, leaders could help build out and support their nurses on the front lines.
That's fantastic to hear, Dan, and what great initiatives. And the mental health component of that, you're right. We've seen so many images of distraught nurses and physicians, and your heart just really goes out to these folks who are risking, their lives every day to really help those in need, and to really combat this pandemic. What advice do you have for someone who's been, on both sides? You've been on the clinical side of it, you've been on the administrative side in terms of, self-care. What could an individual nurse do to, take care of themselves on a daily basis?
Yeah, I think the biggest thing that most clinicians and the media is not helping it either is we feel like we have to be heroes, I think, and the media portrays that, and our professional organizations are portraying that. But heroes, are ones that sacrifice themselves for others, and that's definitely happening. But I think we need to take a step back and say, it's okay for me to go talk to somebody. It's okay for me to acknowledge that I may not be able to handle this. And I think that's the first step. And there are a ton of resources out there. The American Nurses Association just put out a whole mental health resource page in partnership with for the Emergency Nurses Association, American Psychological Association. So there's a ton of resources out there that you can access. And what I'm seeing is nurses don't take that first step, where they feel like they have to kind of put on a save face, or put on their armor around that. And I think the first step of letting down your armor, saying it's okay to break down. And I did it too early on in COVID. I was working with hundreds of nurses going to the front lines. I was hearing their stories. I was talking to them. The gravity of that wasn't lost on me, and I even teared up a few times and broke down in the stress. And so, and I had to talk to some people. And so just reach out and build your peer network, talk to your family, and use the resources out there, because it's okay, and it's going to make you a stronger clinician in the end. If you let it fester, then that's when you burn out, and you're not going to be able to give the best care to your patients or help your peers.
Thanks for sharing that, Dan. Definitely words of wisdom that, in order to serve someone, you really have to, serve and take care of yourself first. So thank you for that. Many faculty too have been impacted by, COVID in terms of how do they instruct their students when they were forced to move online during the spring semester? I know that you started your career, your teaching career at Ohio State University, and you've been teaching online since the inception of your career. What advice would you give for those who are teaching online, maybe for the first time? Or how do you approach online learning? How do you engage your students? Because we've heard that this has been such a challenge, especially for those faculty who might have done this for the first time, albeit abruptly, with little time to prepare, and really just having to kind of carry over the continuity of moving from, say, a hybrid approach. Maybe they were face to face and now they're strictly online.
Yeah, I think there's a couple kind of key themes that you can use to move from in person to online. I think the first one is don't just try to replicate the in person experience. Online experience. And what I see, one of the things I see kind of fall flat in that transition is, you're used to giving a lecture to a class in person, and now you've just digitized that lecture and give it to them online. Well, when they're not in class, it's really easy to multitask. It's really easy not to pay attention, and I think lecture online is not as engaging as it may be in person, because there's just not that connection of people. So instead of taking lecture and just digitizing it, what can you do to get that content delivered in a different way? And there's a lot of tools out there, including things that are linked to the textbooks that we've written and that Jones and Bartlett has, and other solutions like Osmosis and Khan Academy. There's just really good learning science-based tools around content. And so how can you have the students go find that content, learn it, and then the in-person sessions online or the virtual sessions become more about discussion of that content or summarizing it or making it relevant rather than just spouting off a lecture based on a PowerPoint. And if you still want to give your lecture, that's fine, but record it. Don't make students sit through you live lecturing. Record that stuff early on, have them listen to it, and then use the forum to do discussions. I think those are the type of things that you just have to flip your mindset. It's not you're not holding class in person anymore. It's the content needs to be delivered, and now your online sessions are about the context and discussion. I think that's a big piece. And then I think the other one is just thinking about how you can leverage tools that are already out there and content that's already out there, so you're not having to recreate all this stuff. There's you can basically go to medical school and nursing school for free on the internet. There's really awesome content on YouTube and other places that you can just link to. And so use those resources and then spend your time trying to help the students consolidate it and make it relevant in person or on the virtual. And then, try and be innovative, try things. Like, this is a new world. There's been people that have taught online for a long time and to varying levels of success, but try out new things. This is your chance to be disruptive. And so see it as a challenge and an opportunity to turn chaos into innovation rather than a stressor that you have to adapt to and get through. And I think that'll change your mindset, and you'll be able to build out things a little bit better.
So it sounds like you're really advocating for more of that flipped classroom, which we've been talking about for years. I think that's probably very true today. We want instructors or advise them to record their sessions first and use that as the basis for dialogue in the classroom.
Yep. Yeah, and there's some really great tools out there. I mean, like learning methodologies that you can follow that give you step-by-step guides. So the Kaiser Med School, for example, there's no lecture in any of their classes. They literally do not have lecture in any of their programs. And so all the content, the passive content, is delivered before they come into class. And then when they're in class, they do team-based learning, and that's a formal methodology of learning that you can follow, kind of pre-test, post-test, and interactive sessions. And that's how they're learning, and you can easily digitize that. And so I think just challenging yourself to think about different ways of learning and using tools that match with the latest neuroscience. There's a great book out there called Make It Stick. and it's all about learning science and the new ways of how people, absorb content and knowledge. And so I think that's a great resource for people to think about how they might flip the classroom, and then all the theory and research that goes behind that.
Excellent. Thanks for those recommendations, Dan. I know that those will be really helpful. And just to recap, you had mentioned Osmosis, Khan Academy, and then lastly, the book Make It Stick regarding learning science.
Yep.
Well, that concludes our podcast today. Dan, it was a real pleasure speaking to you today. We really thank you for your helpful insight on leadership, on transitioning to online learning, for your advice to those who are starting out a new career and who want to move that career along to potential leadership positions. I just want to reiterate again, if you're interested in learning a little bit more about the latest textbook that Dan has co-authored along with Sandra Davidson, that would be Leadership for Evidence-Based Innovation in Nursing. You can purchase that or request a review copy if you're a faculty member at go.jblearning.com/LEBI2E. And also just a reminder that Dan does host a podcast called The Handoff. You can find that on iTunes, Spotify, as well as on his company site, trustedhealth.com. And we just want to thank you for joining today.
Yeah, thanks for having me. And again, I'm happy to be a resource. You can find me on LinkedIn if you want to connect and talk more. I'm happy to do that. So just really appreciate the conversation today.
Excellent. Thanks, Dan.
Yeah.